Hi, this is Dr. Toby, your host on Health and Wellness. This week we have a great show. You don't want to miss it. Heather and Jeremy King, both medical people. Heather is an infectious disease nurse practitioner who rose through the ranks, went to university, went to college, got her nurse practitioner, helps people with hepatitis, helps people with HIV and different infectious diseases. Her husband is an EMT, he's an emergency medical technician, and he's now the trainer and the leader of the University of Mississippi Medical Center, ACLS, ATLS, where they have trainings for people who want to get BLS certified. You don't want to miss this awesome couple. They have two children, and they are a Christian couple, and they've been giving their lives out to people who need help the most. You will be blessed by hearing about Jeremy and Heather King, EMT and nurse practitioner. It's a show you wouldn't want to miss. God bless you. Jesus is Lord. Hi, this is Dr. Toby, your host on Health and Wellness. Thank you for joining us. We're delighted that you could join us. We have a stellar team, Miss Heather King and Mr. Jeremy King. Jeremy is a director of the Training Center for ACLS, ATLS, BLS at the University of Mississippi Medical Center. And Heather is an infectious disease nurse practitioner. And of course, I'm a family physician also at the University of Mississippi. And we do not express any claim to speak on the behalf of the University of Mississippi. We're speaking on our personal capacity as individuals. So we are so delighted that you could join us today because Heather, we're going to start with Heather, is going to tell us about what influenced her to go into nursing and nurse practitioner and maybe even infectious disease. So you went to college in Ole Miss, then you did undergrad in UMC, then you now came back and did a master's.
Right.
Also
correct.
at UMC?
Correct.
Okay. Was there any parental or grandparental influence in those directions?
No, actually there was not. My mother is a dental assistant, or was a dental assistant. She's retired from that. My father was a mechanic, and he builds transmissions, racing transmissions now.
Oh, wow. In Pearl?
They live in Madison County.
Okay.
So.
I mean, I presume he owns his own. I mean, for you to build racing transmission, that's like a very narrow.
Right. He does have a business.
Okay.
So none of my family was ever in the healthcare field, other than my mother, was with dental. But as a young child, I was always intrigued by just, the human body, and when someone was sick or injured, I always wanted to be right there, looking on. And so I guess I knew from an early age that I wanted to be in the medical field, and so I decided to become a nurse.
And after 2 years of practice, you went back for nurse practitioner. Was that what happened?
Correct. I went back and I got my master's degree in.
What were you doing those 2 years? Was it hospital? Was it clinic? Was it?
I was a labor and delivery nurse.
Wow.
I really enjoyed it. It was a lot of fun.
Pretty impressive.
It was a lot of fun.
Okay. Which part did you enjoy most? The placenta delivery, or the baby delivery, or the mother before the delivery?
Of course, the baby, of course. No, I enjoyed all aspects of it.
Okay.
It's an interesting area to be in.
Right.
It's never boring.
Right.
You never know what's going to happen. You always hope for a good, happy, healthy delivery, but of course,
So
sometimes.
we'll have expected you to become a midwife, but you ended up in infectious disease.
Right. So there aren't. I thought about that, but there really aren't any midwives in Mississippi.
Oh, really?
Right. I would have had to move to another state for that.
Oh, wow. I didn't realize that.
Yes.
So you have to train in another state and come back.
I believe midwives are not allowed. At that point in time, there were no midwives in Mississippi at that point in time. Now, that might have changed, but at that point in time, you could not deliver.
Okay.
Right. So I decided I want to go back and become a family nurse practitioner.
Nice.
So that way I could care for, patients from birth to end of life.
Right.
And I could diagnose and treat and be there for my patients throughout their life.
Awesome. Wow, that's fantastic. Let's talk about Jeremy. So you went into EMT after a couple of years of music education.
Right.
Maybe 2 years, maybe 3 years?
So it was a bachelor's degree, 4 years, and then my working experience
Right.
really was 1 year.
1 year,
I
okay.
knew after about 1 year that was, I'd rather run into burning buildings than teach high school. So, I pursued that path. And in order to get in the fire department at that time, it was very competitive. So to get a leg up, I knew they all had to be EMTs. So I put myself through EMT school and
How
joined.
many years is that?
That's just, it's 1 semester.
Okay.
It's 1 semester. So 1 semester there, and then joined a reserve, as a reserve or volunteer firefighter.
What
Just
parish? What town?
This was in Pearl.
Pearl,
Yeah,
okay.
Pearl, Mississippi. They had a reserve. They had a full-time fire department, but they still used volunteers as well. So I was able to get my foot in the door with the volunteers. And so at that time, like there just weren't that many positions open. So I would apply to all the fire departments around the Jackson area, and the first
Wow.
one that hired me was Brandon. So I was there for a few years, and Madison Fire Department said, "Hey, we'll send you to paramedic school if you'll come over here." And so,
So you want to explain to my viewers, EMT, paramedics, firemen, what is the difference? Because these are 3 different terms.
sure. So EMT in its basic form is emergency medical technician. And while the terms have changed just a little bit, EMT, they had an EMT basic, an EMT intermediate, and then an EMTP, which was paramedic. And depending on what level you operate, depends on what you can do. So a basic EMT gets a basic knowledge of what's going on and can deliver, say, oxygen, maybe assist patients with their own medications, like maybe nitro. Whereas a paramedic can do more invasive procedures. We can intubate, we can give drugs, specific drugs, and work under a protocol that will allow us to do some pretty invasive procedures and life-saving techniques that maybe your basic could not. The intermediate is just what it mentions. They're right there in between.
Can you be a fireman without EMT or paramedic training?
So you can. A lot of the paid professional fire departments these days are requiring at least EMT, and they're hoping for paramedics. So that's kind of in the fire department world. If you want to get a leg up there and climb the ladder, so to speak, you go to paramedic school, or you try to. And so that's kind of how my path went there. It was a leg up, but then there are those instances where you just felt like you could have done a little bit more for your patient if you had a little bit more knowledge or a little bit or a different level of training. So that's what really spurred me to go to paramedic school.
How many years was paramedic school? Oh, how many months?
So paramedic school was another year of training. Okay. So 1 full year of training, and plus the EMT, the 6 months or 1 semester of EMT training will get you into paramedic school. And if you want your bachelor's degree or your associate's degree, there's all the other English classes and things that go along with it. So it can be 2 to 2.5 years, I suppose.
Wow. So you got that paramedic from Madison Fire Department.
Right.
You worked with them for a couple of years.
I worked there for about 13 years.
Then you went to the training center.
So from there, I went to the Mississippi Fire Academy. Right, where I was an instructor out there for a couple of years, and it will probably go down as the best job I've ever had. I loved it out there. I went to work every day and set things on fire and got to put them out and then break things and just be around a bunch of good guys, right?
All you did was train folks.
I trained firefighters.
You didn't go out when the fires, or you didn't do the.
Well, I stayed on a volunteer fire department to keep up my skills a little bit,
definitely.
but run some calls. I'm always going to be that emergency junkie, if you will. But for the most part, out at the fire academy, we're training new firemen and then other experienced firemen in different techniques. And so while we were out there, our new director came in and said, "Hey, we're going the medical route." I said, "Okay, sounds good." And so being that I had a nursing degree and a paramedic degree.
Wait, nursing degree?
Yeah, I have a
It's a
nursing degree too.
Wait, after Old Miss?
This is after paramedic. So after
Oh my
paramedic,
goodness.
the fire department is wonderful. It's a great avenue for you. It provides some time in your downtime to continue your studies and education. So while working at the fire department, I was able to complete a master's degree, the paramedic training, and the nursing degree, all while basically sitting at the fire station and using
Master's degree in what?
a master's degree in executive fireground leadership. So it's a leadership degree.
And then a bachelor's in nursing?
I've got a bachelor's, well, I've got an associate's in
Associate,
nursing,
right.
and then a bachelor's in music education,
Wow,
and then an
that's
associate's
amazing.
in paramedic.
Wow.
But it's just been a continual evolution of learning and learning and learning.
awesome.
But the fire department provided that avenue because in our downtime I could study and I could do my work while I was getting paid. It was amazing.
Wow. And obviously, all that consummated and you coming to University of Mississippi after a couple of years at the Fire Academy.
So right, after a couple of years at the Fire Academy, we were busy out there. We ended up changing the state law to allow the Fire Academy to teach EMT and advanced EMT. So with that, there was curriculum development, but we also had to have our basic life support, BLS. And we said, well, what do we need to do for that? Well, we want to train our people. We want our people to go to UMC because that's where they're going to get the best experience in clinicals. So we're going to go the AHA route. So while I was there, we started up the training center, the AHA training center at the Fire Academy. So when the AHA training center director spot came open at UMC, I said, well, I've been training for this all my life. Let me see what, I put in for it, and here you go. Now I'm working in that aspect.
Okay. An amazing route. I mean, you've obviously impacted a lot of people. My viewers are watching. They just want to know, what will it take for them to get into EMT in terms of prerequisites, high school, college, ACT. What do they need to be an EMT? What do they need to be a paramedic? What do they need to be a fireman? I mean, are there any prerequisites, or you just show up and then get trained?
So right now, I'll tell you, the emergency services, whether it be on the ambulance and being an EMT or a paramedic on the ambulance, or your fire departments nationwide, are very much struggling for personnel. I would say that most require probably some kind of high school background. Equivalent, probably some are 18 years and some are 21 years of age. It just depends on what the department accepts. But just basically, you need to have a fairly clean background and a pulse and maybe a high school diploma.
Okay.
And they're going to take you these days, and that's going to be your avenue for following this pathway or another pathway, whatever you'd like to do.
So just show up and you'll probably get hired.
At this point in time, you show up, you're in decent physical condition, and you're a pretty good person, and they're going to welcome you with open arms into the fire service.
So they expect you to be physically fit to some degree.
To some degree, we're putting on anywhere from 60 to 80 pounds of gear, and as you can imagine, it's super hot in the summer right now at 100 degrees, and you have to be able to perform in that environment for I'd say an extended period of time. So there's a physical fitness part of that you need to be prepared for sure. And if not, they'll get you in shape.
Okay.
They'll get you in shape.
So Heather, I got to know you through your work with HIV in the University of Mississippi.
Yes.
And thank you for your service, because it's such a disenfranchised and maybe some people say marginalized community. But you were like every one of them. You were seeing them. You don't see them as much these days, right?
Oh, I do.
You still do? Okay, I know you have other colleagues helping.
Right, so I see patients with HIV, hepatitis B, and hepatitis C.
Okay. So what drew you from, I mean, you're a nurse practitioner, you could do anything, family nurse practitioner. What drew you to infectious disease? Was it a calling or?
So, right out of school, I was working as an NP in pain management.
At UMC?
No, not at UMC,
okay.
privately.
Private practice.
Right, and the physician I was working with ended up closing his practice. He was going to move, and so I was looking for a new job, and a position became available with UMC with the Division of ID with research. And so I interviewed for that position and was accepted. And so I worked with our infectious disease research patients for a few years.
Okay.
And then the position I'm in became available, and they asked me to apply for that position.
Did you do the research on Cabanuva? Was that you?
No, that
No.
was not me. That was one of my colleagues.
Oh,
though.
okay, okay.
But no.
So you did more of the triple therapy, a triplet? Or?
So the research I was involved in was with STDs.
Okay. Good.
And so that was the research I was involved in prior
Okay.
to this position. So I interviewed for this position, and I've
Okay.
been in this position since, oh goodness, for about 12 years now.
Wow, awesome. It takes a lot to learn all those drugs, and obviously they change every year. The world of HIV and hepatitis is dynamic,
It is.
you know. But what do you think we can do as a nation? I know the president has declared the end of the HIV epidemic, but if you look at the statistics, I think they say about 20% of people do not know they have HIV. So what can we do to reduce that number and reduce the number of people? I think they said 5 million Americans have hepatitis C and maybe 3 million. I don't know, have something has HIV or something. How can we do better? How can we reduce the numbers, especially those who do not know they have it? You know, what do you recommend for primary care physicians, for my patients who are watching? What should they do when they go and see their primary care doctor?
I think that is a great question. There are many things that we can do as providers. One is test.
Okay.
Screen your patients. For hepatitis C, it's recommended that we screen all patients at least once. And then if your patient has risk factors for hepatitis, then you would screen them as appropriate. So that's the first thing, is screen. If a patient is positive,
Right.
then refer them for care. If you're not comfortable treating them for hepatitis C or not comfortable with the medications for HIV, then go ahead and refer them for treatment. Both are treatable. Hepatitis C is actually curable now. Greater than 95% chance that we cure you with quick and easy treatment.
Or the 90-day or the 90-day?
Well, it's
right?
8 weeks to 12 weeks,
Okay.
depending on the medication that we use. Very tolerable. HIV is treatable. I think with both of those illnesses, both illnesses are diseases that are misunderstood. I think we need to educate our patients, the community, and other providers regarding the misconceptions about HIV and hepatitis C. Anyone can get HIV or hepatitis C. It's important that those patients that have HIV or hepatitis C, that they don't feel like their life is over. It's not. You can live a full,
normal life.
healthy life living with these illnesses.
I
Like
mean,
I
you've
said,
seen patients who live a
yes,
normal life.
yes,
right?
a normal, healthy, fruitful life.
But there's still a stigma attached to it in the community.
Yes, unfortunately, and I think that's where education comes into play, is with educating our patients and the community and providers as well. But testing, treating with HIV, you treat a patient, they're undetectable. Undetectable equals untransmittable.
So why does I mean, in some medical communities, they don't encourage the taking on of those patients. I guess there's a stigma even from the medical community. If I take this patient on, it's going to come with a lot of detail maybe, and a lot of screening and a lot of education. And people unfortunately have stigmatized this population to be IV drug users, promiscuous, you know, not ideal patients, as if there's any ideal patient,
Right.
you know. So what would you say to the medical community, I mean, who stigmatize? It may not even be the patients who stigmatize themselves. The medical community may stigmatize the patients and say, we don't want this patient, we want... So how can we stop this discrimination, literally?
Right. So, again, I think it's education. HIV is not just in our drug user community or those who are
same-sex,
promiscuous or
right.
same-sex community. It's in every community, every age group. Our patients, if you're not comfortable treating their HIV, then you treat all of their other health conditions the same way you would treat someone that does not have HIV. And then we will take care of the HIV care.
And you and I know you cannot get HIV by treating somebody.
No.
You know, it's all the myth of the past. Oh, if you a needle stick. I mean, those are few and far between.
Right.
Have
Very
you seen
few.
any transmissions from a doctor in your department who got HIV?
No.
It's very rare.
No, and you cannot get it from a hug, from a handshake, from a kiss, from eating or drinking after someone.
Right.
You can't get it that way. But no, I have not seen it transmitted
So,
through casual contact.
and most of the treatment now is just tablets
Yes,
with less side effects than they used to have.
much
So
less.
there's really no reason why anybody with HIV should not get treated or tested and treated. And if you don't have insurance, there's actually a grant from the federal government. Am I correct? What's the name of it? The Ryan White grant.
Ryan White, yes.
That enables every HIV person in the country to get free access.
Yes, free
to
care,
medications.
free medication. Even if the patient doesn't have insurance, we will see them.
Right.
There are many Ryan White funded programs all over the United States. So no matter where that patient lives, they can get connected with a clinic.
Right.
And, you know, like I said, getting them treated and staying in care is going to be one of the biggest
Important.
things.
Right.
And then there's also PrEP, which is pre-exposure prophylaxis.
Right.
So for those patients who are at risk of contracting HIV, you can take a medication once a day to prevent the acquisition of HIV.
So we have two in the market, Truvada and there's a second one.
Descovy.
Descovy.
Yes.
So you can take any of those to prevent. And the people who should take it are high-risk sexual activity, IV drug users,
Yes.
multiple partners, really.
Yes.
I guess history of STDs may be a reason.
Maybe, yes.
Multiple
If you have multiple
STDs,
partners.
Right, multiple partners.
Right.
And then several other. Yeah, I wanted to give a shout out, Jeremy, to your mentors on this journey. Who do you think along the line, I mean, you've obviously risen to the very top of your profession, but I'm sure you were standing on the shoulders of giants along the way.
Well,
So who mentored you? Who gave you inside direction and motivation, maybe?
Sure, I've had quite a few good people along the lines. I imagine anybody would that's prolific in their life would have some folks that have helped them out, because we don't do it on our own for sure. So some of my teachers, some of my bosses have greatly affected me in the way that my outlook on life and how I perform. And that could be, say, my music teacher, my college music teacher, where he was very detailed and precise, and he taught me that if you want to be the best, then you're going to have to look at every little detail and get those details right, or you're not going to be at the level where you can.
It was your co-worker at the academy that told me you play music. That means you really play music, because she's my patient. And she was saying, oh yeah, you know Jeremy? He's always playing the guitar. I was like, seriously? At work?
Yeah. So those folks.
So that's how I heard you play the guitar. That means you really, really, really love this music stuff.
I do. Like I said, that was.
So EMT might be your second love.
Yeah.
Music is actually your first
music's
love.
my first love. It takes me to places I don't think I could ever go. It's just amazing.
Tell
to
us
me.
about music, because let's go to the music now. We've
Let's
talked
go to
a lot
music.
about.
Well, for some reason, I can remember being young, really young, 5 or 6 years old, and going putting on some headphones and listening to entire albums of music, and just laying on the floor listening to these record albums. Constantly, I had a little record player, or at first it was my parents, and I would just go back there and grab the Michael Jackson record and put it on there and just listen and listen and listen over and over. Or it may have been a Queen album or whatever it was that they had. So I don't know where it came from. I can remember going to bed, turning on music, and then turning on maybe a Randy Travis CD, or it may have been some kind of hard rock CD as I progressed. But every night I would have something playing in a loop all night long while I was sleeping. And so I don't know if that had a part of it. There was just this innate love or need for this one particular thing from me, and I don't know what caused it, but You get chill bumps sometimes listening to it, or if you're in a good group, everything goes away. And you just find yourself, it's almost an out-of-body experience, if you will.
But you're not in a group right now.
I play with some folks here and there, but I can just remember some of the pinnacle moments of my life has been lost in just this singing where you just go away, and all of a sudden it's more of this collective kind of thing, almost an out-of-body experience. So it's really weird to try to describe
tell us
it.
exactly the pinnacle. I mean, you talk about these moments. Where did you minister? Was it in like Madison Square Garden or Carnegie Hall? I mean, what are these places you said you had your pinnacle
It's
moments?
in practice. It's in practice. It was in practice with this choir at the University of Mississippi,
Really?
where I didn't feel like I should be there. They were too good, but I just happened to be in it, know.
Okay.
And then all of a sudden, everybody's just on the same page. You get 50 people on the same page, and one person out there directing this thing and requiring every bit of your attention and attention to detail. And all of a sudden, it all comes together, and it's just in a rehearsal room. Everything goes away, and it's an amazing experience. And then I remember if you had a cold or something, maybe you didn't feel like singing that day, I still would not miss the rehearsal. I would sit out and listen and go, oh my gosh, they're so great. How am I even a part of this? I don't belong here. I'm not good enough. But apparently they kept me coming back. So just been a great love of my life for sure.
Wow, wow. So that was how you started on the road to, music, then EMT. And you wanted to show us a few things on CPR. We'll talk about that on the next show. How about you? Any mentors, professional, maybe educational, maybe spiritual, maybe psychological, maybe family? Any mentors on your journey through life? You want to give some kudos to?
I'd say I've had several. My nursing educators, nursing school, they were wonderful, very encouraging. Always wanted me to do my best. In my career, I've had several physicians and other nurse practitioners who, again, have been very encouraging, always wanted me to do my best. Always had an open door policy, could sit down, ask any questions, willing to educate and guide me along my way.
Amazing. You talked about your educators, and wow. So at this point in time, you're not doing any teaching of your own. You're not training nursing students.
I do not train any nursing students, no. I do help to train other providers, through AETC, AIDS Education Training Center, regarding hepatitis C, like hepatitis C workup for primary care, and co-infection, HIV hepatitis C.
Wow. Well, we've been talking to Heather and Jeremy King. They're going to come back. Jeremy's going to give us some illustration on what CPR is and how we as all individuals can help each other every time, anytime we see an emergency. And Heather will close out on some nuggets for how to relate with the HIV and hepatitis community and how she's been working with them for the last 12 years. God bless you. Jesus is Lord. Amen.